Hello everyone, welcome to day 5 in genetics. Here I am going to discuss a very important table. See, actually it is this table, or based on this table only, we are going to discuss almost all the genetic disorders, whether it may be some collagen deficiency, a lysosomal storage disorder, glycogen storage disorders, whatever it may be, all is based on this simple table. So, biochemical and molecular basis of some Mendelian disorders. Enzyme deficiency, phenylalanine hydroxylase causes phenylketonuria. Hexosaminidase A deficiency causes Tay-Sachs, and SCID because of adenosine deaminase deficiency. Remember, what is the molecular relation? Actually, that means what is the problem which is happening. Okay, yes. Splice site mutation with reduced amount, that means reduced protein synthesis. Whereas in hexosaminidase A, there is splice site mutation or frame shift mutation with the stop codon. And adenosine deaminase deficiency is point mutation. Each line is important. Each line can be asked as a question in assertion reason or in multiple answer type, match the following type, whatever it may. Suppose enzyme inhibitor is deficient. Alpha 1 antitrypsin deficiency, which is a missense mutation. Disease, emphysema and liver disease. Receptor deficiency. We have the most important one, familial hypercholesterolemia, which is an autosomal dominant condition. Okay, point mutations or deletions, that is deletions. Low density lipoprotein receptor. Vitamin D receptor, again point mutation. Vitamin D resistant rickets, which is, yes, what is inheritance? X-linked dominant. This is autosomal dominant. Coming into transport, oxygen, hemoglobin. Whenever there is deletion, what will happen? Alpha beta thalassemia. Cystic fibrosis, transmembrane conductance regulator, again cystic fibrosis. Cystic fibrosis. Then point mutations, abnormal structure. You know, glutamic acid is replaced by valine. Glutamic acid is replaced by valine. Okay, glutamic acid is replaced by valine. So that is point mutation, abnormal structure. Sickle cell anemia. Then we have extracellular, structural, collagen deficiency, osteogenesis imperfecta. Okay, deletion or point mutation, osteogenesis imperfecta. Fibrillin, whose deficiency causes Marfan syndrome. Remember, collagen deficiency, we have two conditions. One is Ehlers-Danlos syndrome, osteogenesis imperfecta. Okay, they are autosomal dominant condition. Even Marfan syndrome is autosomal dominant, but it is because of fibrillin missense mutation. Dystrophin, deletion, Duchenne or Becker's muscular dystrophy. Spectrin ankyrin, okay, that is hereditary spherocytosis. Factor VIII deficiency, hemophilia A, which may be either deletion, insertion or nonsense mutation. Then retinoblastoma protein deletion, which causes hereditary retinoblastoma. Neurofibromin, heterogeneous. What is that? Neurofibromatosis type 1. Okay, neurofibromatosis type 1. Okay, so at last, the summary of this table, what I want to tell you all is that if you understand this, the basic mechanism, for example, if someone is asking in vitamin D resistant ricket, what is actually the problem? There will be point mutation of vitamin D receptor. In sickle cell anemia, point mutation. In Marfan syndrome, missense mutation of the fibrillin. In hemophilia A, factor VIII undergo deletion or nonsense mutation. Fine. In phenylketonuria, actually this question has been asked in JIPMER. Splice site mutation is the one that is responsible for phenylketonuria, phenylalanine hydroxylase enzyme deficiency. Neurofibromatosis type 1, again autosomal dominant. CFTR, deletion, cystic fibrosis. So, in this table, the author wants to give you a gist of all the genetic disorder. If you have this basic points in mind, when you start about the pathogenesis of or about the features of sickle cell anemia, you can understand what is the molecular lesion in sickle cell anemia. Point mutation in glutamic acid replaced by valine at the 6th position of the beta chain of hemoglobin, sickle cell anemia. So actually, based on this whole table only, the whole chapter of Robbins is going to be, that is the genetics is based on. Fine. Okay. I hope this session is very useful for you. Thank you. Please go through this. This is a very, very important table. Thank you.